Professor Subodh.
So I just want to take a different thing. I think this is where I think government should come in. Because what government can do is your economies of scale. You are not looking at very few. Like I can just give you an example of the trauma centers. I think Tamil Nadu created this entire trauma center, and we have heard a lot of stories about somebody dying in the outskirts, trying to enter into the city, trying to reach a private hospital, and deaths, death in between. So Tamil Nadu started. Telangana has now adopted it. So I think once government gets into that, so it is irrespective of who is. I think if you are an emergency, your ambulance or your service takes you to the nearest point. So that way, government can, I think, because there the economics come in, where you have a large state, the economics of scale will work, your cost is coming down, and government, I think that's what is your point also. You need to encourage governments to sort of do it. And the second point is, we also should look at those best practices. I think we are talking about what we see in the field. Like in eye care, right, we have an excellent model very close to us, LV Prasad. So that's a very, very interesting, I would say, it's purely quality, so it's not a camp approach what they do. There is a vision center which actually screens all of them. There's a community empathy factor already is built in, and only when they to the end page they actually come in. And I somehow, because we have a program on hospital management, I interact with a lot of hospitals. I am very, very optimistic, right? Because I have experienced a lot of doctors, and many of my students work in these hospitals. They've told me not everybody gets a surgery. Like I suppose if somebody goes to a cardiologist, somebody goes to a gynecologist. There are many places they've just gone and check up and come back and said, can we keep you on like 6 months for a treatment? So I think fee for service is there. Maybe the outpatient charges are 10, but not everybody goes. So I think this is where one of our favorite subjects in our hospital management is law of ethics. The whole ethics of the healthcare is very important. But I have also another question. Somebody, my top management in ASCI, who is a retired IAS officer, he asked, which is the most ethical hospital in Hyderabad? I said, I don't have an answer for that. Nobody has. I think, but there are good examples, and I think that is why Hyderabad is also being built as sort of a model. And also the communication. I think this is something which has actually happened. How do you communicate to a patient? Right? 50% problem is solved when doctors communicate to the patients, and that's when the trust is built. And I can quote so many examples in Hyderabad, including Fernandez, and a lot of where the doctors communicate. The biggest challenge we have faced post-COVID is, because of COVID, doctors are not actually, even some very eminent doctors told we are now doing only video call because we don't want to go near those kind of issues. There's a little bit of ethics, communication, those things are happening, and the larger question is the government has to do that.
So on that note, you have something to add?
I am a great believer in checklists. For every activity you must have a checklist. Yes, no, number 1, option number 2, option number 3, option number 4. To me, the checklist must be firmly implemented in the primary health care that if he has got A, B, C, he must do this. If he has got C, D, Z, he must do that. Once you start doing this kind of stuff at primary health care, things will become much better than what we anticipate. See, and secondly, the problem with us Indian per se is that you ask a question, he will give you 5 kinds of answers. For example, in '96 when I started my career in healthcare, I went to Pochampalli, and the guy would never ask the patient age. The small bits of this 1 inch by 1 inch paper where you write down for the PHC word. You would never ask the patient age. So I said, yeah, why don't you ask the age? He said, you want me to ask age? Let's see this case. So a lady comes in, says, how old are you? And she says, Vardal ochindi kada up to 6th class low now. That is, when the cyclone came, I was in 6th class. Now cyclone comes every 2 years in Hyderabad in Andhra Pradesh, and she was in 6th class, you don't know when. First happened this, and the second case came in. How old are you? 25 Rasko. She had a daughter who was 14 years old. 25 Rasko. Says, now you understand? Things have changed. Aadhaar card is there, lots of benefits are coming. Now it is easier to implement checklist. All ASHA workers have got tabs. So start doing that checklist and do the analysis in the background and come back and say, let's focus on eliminating the disease at that level of PHC or primary or secondary care. Tertiary care, let it be with private sector. Government must focus only on primary and secondary care. If they start doing it, things are going to improve. Will it happen? I believe in 15 years time it will happen.